Welcome everybody for our Facebook Live for 2022. We have special guests that include our chairman, our incident commander, our tribal health director, our COVID-19 data man, and also our HRSA director. So I'm going to go ahead and give the floor to our chairman, Devon Boyer. Devon.
Hello, everyone. It's good to speak to not only our membership, but anyone who's viewing today. It's been a while, but we're trying to keep everyone up to date as far as what COVID is doing, what it's not doing, where we're going with it, and what's going to happen with it. At the present time, I just want to remind everyone that COVID has not gone away. It's still here. And there's probably going to be a variant or two that happens in the future, I'm sure, but that's just due to people who don't want to get vaccinated. So we still encourage that. We still encourage that if you want to wear masks, that you should still wear masks. Also, make sure that you're still washing hands as much as possible. You know, these things, they're out there for a reason. But having that said, and to give you more detail as to why those things are, I'll turn it over to our incident commander, Mr. Eric King.
Good afternoon, everybody, and thank you. The Fort Hall Business Council has lifted the mask mandate for the reservation. This decision was based on the low positivity rate of the COVID and as well as the CDC recommendations. I do appreciate everybody's cooperation in the past 3 years of dealing with this and adhering to all of the tribal's policies and safety protocols. At any time our numbers do increase, the council does have the ability to reinstate any and all of the mandates, including face masks and that kind of thing. But we still want to encourage, even though we've lifted the mask mandate, we still want to encourage the community to stay safe. Just like the chairman said, keep your distance, wash your hands, you know, do all the things that we've been doing for the past 3 years as best as we can. Don't get too laxed because it's still here. And the big thing is getting vaccinated. Get a hold of one of the clinics and get your vaccination. I mean, that's really is what's going to help keep this thing slow. So we've lifted that. We also, some of the particulars is if we do have tribal events that are inside and are over 20 people and or serving food, we still have to have safety plans. Funeral recommendations have been lifted, but again, be smart. Follow all the recommendations that we've put in place over the past few years, just to keep everybody safe. It's still there. So I think right now our numbers are like 2, but Travis, when he gets in there, he'll get on that. And but I want to appreciate everybody for all they've done in the past years, and still be safe out there. Thank you.
And Eric, this applies to all properties on the Fort Hall Reservation, correct?
That is correct.
So casino, hotel, tribal enterprises, the tribal museum. So this will all be posted publicly.
Yes.
Okay, next we have Sunny Stone, who is our tribal health director. Sunny?
Hi there. So I wanted to kind of touch on some of the changes with the masking mandates or the lifting of the mask mandate. We are really trying to base this on the guidance that the CDC provides us, which uses the most up-to-date data and really provides us that ability to use science to drive these decisions. And so though the mask mandate has been lifted, we really want people to be aware of what their risk is and when it's appropriate to wear a mask. And so the CDC has provided us with a guide to kind of show when masks should be back on and when we would maybe have the opportunity to take them off for a little bit. So the communities are divided into low, medium, and high risk level as far as the community is concerned. And I'll show you where to go to find that information here shortly. Mike is going to put a link down in the chat to provide the link to this website. So if you're low, if the community is at low risk, people can go around without their masks if they feel comfortable in doing that. It's the CDC still wants people to stay up to date on their vaccination and get tested if they have symptoms, and to wear a mask if you have symptoms, so that you're not. So if you're going into a doctor's office or something like that, you would still want to wear your mask if you are feeling sick like that. But for the general population, it's not necessary to wear a mask if you feel comfortable going without a mask. A medium risk community really looks at if you are at high risk for severe illness, and we've gone over the list of individuals that are at high risk for that severe illness. Then you may want to talk to a healthcare provider or follow this guidance here. There's a link to go over whether or not you should be wearing a mask. Also, if you're an individual that lives in a household with somebody that's high risk, you may want to still continue to wear your mask when your community is at medium risk, so that you can protect your family member. And then finally, there's high risk. And once we get into that high risk, we really want to have people put their masks back on in order to protect community health. So this is a really great tool. And in this tool, up at the top of the page, there's the ability to put in your state and your county, and you just hit go and it'll tell you what risk level your county is at. So that is available and will be shared broadly. The second thing I wanted to talk about is we've updated our community testing schedule. Due to some conflicts in scheduling, we're going to be reducing the amount of testing we're doing for community testing, as well as the reduction in numbers. So it was a decision based on that data and based on the situation we're in now. If we need to ramp testing back up, we will certainly look at that and identify when that's appropriate. That will be available we're going to have Tuesdays at Eagle Lodge from the normal time, noon to 5:45. And then we're moving Buffalo Lodge to Thursdays. And that'll also be noon to 5:45. So it'll just be Eagle and Buffalo Lodge that will be our main testing sites for community testing. And again, there's still availability of testing. The IHS clinic has at-home test kits available. There's availability of test kits to be mailed to your house through the U.S. Postal Service, and we can provide the link for that as well. Now, the third thing I wanted to talk about is I wanted to start to kind of share, what are the myths about vaccination? We hear a lot of things on the news. We hear a lot of things on Facebook about, how vaccination, what is the risk of being vaccinated. And so I just kind of wanted to touch on one myth at a time. So today's myth that we're going to talk about is that the ingredients in the COVID-19 vaccines are dangerous. That is the myth. The fact is that nearly all the ingredients in the COVID-19 vaccines are also ingredients in many other things, like foods. We will have available, this link available as well. Provides information about the vaccine ingredients. And what you can do is you can even go in and look at the specific ingredients to each of these vaccines using the links down below here. There's not any preservatives in the vaccines. There's not any latex or other metals. I know that's been in the past a concern about the use of metals in vaccination, and that's not actually included. None of the vaccines actually include live virus in the vaccination itself. What it does is the vaccine provides you with the blueprint for your body to develop an immune response. And even though sometimes people have side effects from those vaccines, they might have a fever or headache for a day. That is actually your body providing that immune response. That's your immune system working and providing that immune response. So I think it's really important to utilize fact-based information and ensure that we have good information where that comes from. So for instance, right here, we have the Pfizer BioNTech vaccine. We can look at all the list of ingredients here. So we've got the mRNA, there's some lipids and fats. And even though these words are really scary, it's because they're written in scientific format, right? So these are just fats, they're just lipids, and then salts and sugars. And it says what each of these things do inside or as part of the vaccination. So we'll provide that information for folks to review on their own so that we can have, an informed community. So thank you for your time today and have a great day.
Okay, thank you, Sunny. And that actually, talking about vaccinations, that brings us right into Travis's data. Travis, what are we looking like? What's our vaccination rate for Fort Hall?
Thanks, Sunny and Randiel. Thanks for all the information. Travis Martin here. I'm the Tribal Health Data Analyst for the new viewers. I am grateful for this opportunity to share this dashboard finally. So this will be awesome. Can you see that? Okay. Okay. So first of all, to get to this dashboard, I'll get to the information, but to get to the dashboard, you will go on sbtribes.com. And from there, you'll see COVID resources, and then click on that. And after that, you'll see the COVID dashboard, and it'll take you straight to this. I'd like to share the information about some of the vaccines, as Randiel had mentioned, and breakthrough cases and reinfections. And of course, what the current news today of COVID-19. So currently we're at 2,450 cases. Well, first of all, we will start with Fort Hall. These first 4 tabs on top, or excuse me, 1, 2, 3, 4, 5, 6 tabs on top are Fort Hall related. The very last one on the far right is regional data. And you can navigate through all of these. You'll learn as you can click through anything and hover over things, and it'll give you information. So currently we're just under 25,000 total cases. And to give you a perspective, in the beginning of the pandemic from March of 2020 until December of 21, just a few months ago, so 21 months, there were 1,500 total cases. And just in 1 month alone, we had just under 1,000 cases. So just under 40% of all of our cases came from the beginning of 2022. People think it was not too bad, but we still experienced a few deaths. You'll see right here, deaths in the last 30 days is 1, but we've had 2 this year. Hospitalizations also increased just a little. The rate has not been as bad as last year, but still we saw hospitalizations and deaths increase. Down here in the daily new cases, you'll see you can zoom in. Right here, there's a little arrow. You'll see you can select the type of zoom you'd like to use. I'll use this one where I zoom in here, and you can see exactly a lot easier. There's a few different selections. You can choose suspected reinfections, those who are reinfected, who had COVID once before. The red are the breakthrough cases. And again, those are the fully vaccinated cases. And I'll talk about that and about the reinfections and breakthroughs in a minute. And then to zoom out, you just click the home button on the side toolbar. Something scary also to emphasize is about the weekly cases, we don't see as dramatic or steep of an incline in cases, as well as as steep of a decline in cases in any of the trends from December, even October, the worst part of last year. And the worst and the steepest of incline of cases was this year in January. And it was almost symmetrical. As fast as it increased, it decreased just as fast in cases, gratefully. And I bring that up because of the reinfections and the breakthroughs I'd like to talk about. You notice reinfections happened a lot more quickly. You can zoom in to December. The reinfections are those purple ones. We don't see as many reinfections in December of last year. We saw reinfections mostly later, and which is, if you think about the vaccines, I'll go to the vaccines in a minute. People started getting vaccinated mostly in the beginning, January, February, March, April, and May. That was the largest increase of vaccinations. After between 5 to 7 months, we've noticed an increase in reinfections as well as breakthrough cases. And with that said, the vaccine was waning off. That was why the booster, the CDC recommended the booster for fully vaccinated cases or people. And with that evidence or the data, it's evident that the vaccine was working. We did see the increase in cases, but in the beginning, we saw a lot less cases from after people were vaccinated until the vaccine started waning off and we saw an increase in cases, hence the higher number of total reinfections and breakthroughs.
And Travis, the reinfections are, what is the definition of a reinfected per individual and a breakthrough?
Yes, thank you. Good question. And you can hover over the reinfection section and the breakthrough and see that definition. So the reinfection is a person who was infected before, recovered in enough time, usually 90 days is what was recommended before, and then infected again with COVID-19. So the person who caught it twice, but had enough time to recover in between. A breakthrough case is a person who was fully vaccinated. Just who was fully vaccinated and caught COVID-19. So that was a good question. Thank you. Let's move on to, I won't talk too much about the tests. As Sunny had mentioned, all of the cases were low. And Eric mentioned the cases recently have decreased a lot. So we've had to make adjustments to the testing schedule. And obviously the council will adjust if need be. And you can see how many tests were administered, positives in this specific day. Oh, I forgot to mention, on almost all of these tabs, you can scroll to see how we are affected in a certain time frame. This one just looks at the positivity rate. Vaccinations. Fully vaccinated people is right here. Just look at the definition. You can see where we're at right now, currently at 54%. And that includes the total population plus 0 through 0 plus. Because it's a small population, we've included the 0 plus. And the ages, it shows there, ages 0 through 17 and ages 18 plus. You can see the amount of vaccines that were given per day as you look there. And then you can scroll see which vaccine was given. Again, you can zoom in on any of these if you want to see the specifics. Same thing with this on the right graph. You can look at the demographics. I won't talk too much about that. This just something interesting to note is our average age for COVID-19 started high in the beginning of the pandemic and decreased from there. And I bring this up because it's comparable to the vaccine or relatable to the vaccine. In the very beginning, the vaccine wasn't given in March. Data has shown that it has been effective after the vaccine was given. It stayed fairly low, just depending on the variant. We noticed it stayed low. Even with the Omicron, it stayed low. The age stayed low until recently. There have been more higher age groups affected recently in March. But again, a lot of those have not been up to date with their vaccine or the booster. You can see the percentage of the cases by gender with the positive cases, as well as hospitalizations with cases by gender. You can navigate through all this as much as you'd like. This is hospitalizations and deaths, and in a time frame as well, and then breakthroughs. So breakthroughs here, you can see for your own self how many breakthroughs we had. On the first page, it showed 649, and then with metrics of hospitalizations and deaths, and how the vaccine has been effective. And of course, as noted up above, a large portion of the vaccinated population has received Moderna, and therefore there are more breakthrough cases. But the effectiveness is about the same. They've all been very effective in preventing hospitalizations and more deaths. And you can look up on top of the chart, unvaccinated cases. There are 88% of the hospitalizations are unvaccinated cases. Same thing with deceased cases. 85% of those are unvaccinated cases. So it's still continuing to show very effective. Regional data, which Sunny did show the community level risk level for COVID-19. I plan on adding that onto here because our community members, or people on the reservation, tend to go outside of the reservation and travel. So we are all affected by what's happening around us. So that's why this is on here. This is those who are the vaccinated cases. You can see the deaths from yesterday. There were 2 deaths in the surrounding areas. The surrounding areas include, up above it says Bannock, Bingham, Caribou, Power, and Bonneville counties. Same with hospitalizations. You can see that daily rate. And you'll notice in the chart below with the daily new cases, this will be very comparable to Fort Hall. In the cases, the trends are about the same. We follow almost identical to what the region does, usually about a week to 14 days, 1 to 2 weeks behind them. But the Omicron, we were about the same. And I believe that's all I have for now. Just remember that variants can still come out, and we never know what could happen next. It's important to continue to take precautionary action and using the mitigation measures to prevent more sicknesses. Thank you. That's all I have.
Perfect. Thank you, Travis. That takes us into our other tribal health facility, Chris Waterhouse with HRSA. Chris?
Hello. I think today I just want to wrap up some of the comments and reiterate, if you're comfortable wearing a mask, feel free to wear a mask. It's okay. This is not a mask ban. Some people don't like wearing a mask, and that's okay too, as long as our community spread level is low. If you're a person with immune system issues or at high risk for illness, if you live with someone with high risk for illness, or maybe you're a caretaker or see someone frequently who's high risk for illness, feel free to keep wearing your mask. If you're going to go to a crowd, like a basketball game or another sports event that's indoors with a whole bunch of people you don't know, feel free to wear your mask. Masking is fine. Masking might come back to us. The pandemic isn't over yet. We all want it to end. We're all tired of it, but we still need to work to keep ourselves and everyone else around us safe. The other thing is, if you feel ill, if you've got a little tickle in your throat, you don't know what it is exactly, feel free to wear a mask again. That will keep the people around you safe. It's very courteous during this time to wear a mask. I think those are my biggest points, is don't be afraid to mask. And then one thing I really liked about the Business Council is when they passed the resolution lifting the actual mask mandate, they put in a little note in there. People are still okay to wear masks if they want to. And I think that's good to know. The pandemic isn't done with us yet. Even no matter what you see in the news cycles, we live in a very clickbait world where what is shown to us in news is what people are going to click on. So even though there's other world events taking precedence over COVID news, there's still a lot happening in the COVID world. We're here for testing, vaccinations, just like Indian Health Service and tribal health on the tribal health side, and then not Natsugani. Come by and see us.
All right. Thank you, Chris. I really appreciate your the overall message that everyone shared today, that the COVID is not over. The pandemic is still here. I would like to ask the chairman, did you have any message, Chairman, that you would like to express?
Yes, I do. I think it's important to remember the education that came with COVID. From the very beginning, there's a lot of environmental things that was discovered. There was a lot of things that we discovered here at the tribe that were weaknesses, and we need to improve on them. We also need to remember that not only the folks here on today's screen, but a lot of the others that were involved directly, such as first responders and people that were there to help others to receive food, resources that were needed, even shelter. We remember that these people are the folks that you should be saying thank you to, that you should always remember and not forget the sacrifices that they made in the last 2 years in making sure that we had everything that we could get and the protections that we had as well. Thank you.
Thank you, Chairman. So you heard it all here. Thank you, everyone, for joining us for Facebook Live. We have recently changed up how we are presenting our information. I hope that you enjoyed our presentation today. Thank you and have a beautiful day.